Hi, everyone. It's Dr. Jennifer Hahn, clinical pharmacist and co-founder of Scene Nutrition. Super excited to go live today. We have an awesome guest. Her name is Maria Rigopoulou, and I am going to go ahead and invite her. And we've been having technical difficulties, so I hope this works. Let's cross. Okay, I'm going to invite Maria. Hi, welcome. Just inviting Maria right now. Here we go. Looks like it worked. Hi, Maria.
Hello, finally. How are you?
Good. Can you see me okay?
Yes, yes. I don't know why it didn't work last time, but now I restarted everything and it works, so I'm glad.
Yes. Awesome. Okay, we've been having a lot of technical difficulties, so I'm super excited that this works. Bear with us. I was just introducing myself. I'm Dr. Jennifer Hahn. I'm the clinical pharmacist and co-founder of Scene Nutrition, creator of the first real food calcium chew for better bioavailability of calcium and overall better bone health. I'm super excited because we have Maria here. She is a nutrigenomics and pro-aging expert. She specializes in bone health and overall well-being. She's based in London and Greece, and Maria's holistic approach addresses the physical, mental, and emotional imbalances to optimize bone health. She was diagnosed herself with osteoporosis in her 30s, like me, and has been passionate about raising awareness about this often misunderstood and misdiagnosed condition ever since. So thank you so much for joining us. I'm super excited to go over these hot topics.
Yes, true. Me too. I'm really, really happy, and so excited about this discussion because, like you said, it's a condition that is very much misunderstood, and people think that this is an old people's disease and it's going to happen. Well, to women primarily in menopause, but this is not the case, and we both know we were both diagnosed when we were young. Menopause, it wasn't the cause.
Right.
So it's just it starts becoming more and more obvious now that it is a condition that's a lot more complex and involves a lot more beyond menopause and hormonal problems for sure.
Yeah, we're going to dive into all of that, but I just want to start off by asking you, what is nutrigenomics? Because this fascinates me, and I think this would be really interesting for our listeners to know.
Yes, I guess I'm a little bit of a geek. I always was. So I had an interest in health and DNA and all the biohacking stuff and, all these things for many years. I started studying nutrigenomics, which is basically using our own DNA information and with diet and nutrition and lifestyle, make it express in a way that optimizes our health, our function. It sounds a little bit complicated because it is, but now it's much simpler. I mean, in a way that anyone can actually have this sort of test. We can get the results. It's much easier to understand them and interpret the results as well. I've tried during my journey, trying to resolve all the health issues that I had. And of course, my primary concern was my osteoporosis because I was diagnosed when I was very young. I just was just trying to, refine all information that I was finding about this condition. And then I started looking into nutrigenomics, trying really to heal myself in a way. I was just trying to understand why my body reacted this way, why I ended up having these conditions so early in life. And there were a lot of obvious reasons, like nutrient deficiencies, for example, not eating quite right, but nothing really explained fully at this stage what exactly the problem was. So when I started diving deeper and deeper and deeper into the condition, I realized that DNA is also involved in it. And then guess what? If you actually look my DNA profile, the most prominent features there, the worst I would say is anything that has to do with bone health. So it's not really a surprise now that I know that this has happened to me. Of course, there were a lot of other contributing factors as well, but a big factor, probably the biggest one, was actually my own DNA, and my
Mm-hmm.
mom also has it since very young as well.
Mm-hmm. Yeah, I love that nutrigenomics because it's the future of medicine, right? We're all about targeting, doing precise precision medicine. We use pharmacogenomics when we're looking at the metabolism of different medications or drugs in the body, and the same thing, we're looking at how our body uses nutrition in different ways. And the fact is that each person utilizes nutrients differently or absorbs it differently. So I think that's so
Yes,
fascinating.
absolutely.
Um,
Absolutely. And as you said about medication as well, and pharmacology in general, and how different drugs, medications affect us. Of course, DNA gives you a lot of information. The kind of work that you do is even more specialized, but even in the kind of profiles that I look in detoxification, for example, there's certain things, at least for the most common medications, that you can see there as well.
yes, yeah. Um, so I think we're just gonna dive in. We're gonna
Mhm.
hit these high level questions that you and I get all the time, and we just want to
Yes.
clear the air on. And the first one is, can calcium supplements or dietary calcium supplements increase cardiovascular disease, or does it increase the risk of heart attacks or overall cardiovascular disease? And I just want to set the record straight here. The studies examining high levels of circulating calcium um, with increased risk of cardiovascular disease are inconclusive because they have a lot of confounding variables. And actually, the National Osteoporosis Foundation and the American Society for Preventative Cardiology Medicine convened an expert panel from Tufts University, and they came up with this conclusion. The calcium intake from food and supplements that does not exceed the tolerable upper limit intake should be considered safe from a cardiac standpoint. And so,
Mm.
more importantly, these studies that did look and find some increased risk of cardiovascular disease, they were looking at synthetic calcium supplements, so specifically calcium carbonate, but this was not seen with dietary calcium. And that's the super important piece, is that dietary calcium has not been shown to increase cardiovascular events. So dietary calcium, what does that mean? That means calcium from food. And so I wanted to
Good.
hear your take on this.
No, absolutely. I totally agree. This is my clinical experience. This is what studies say. Unless you have some form of um, very rare kind of autoimmune condition that increases either calcium or vitamin D in your blood, like I think it's sarcoidosis or something similar that do that. And in this case, of course, you would be at risk even from dietary calcium, but these are very rare cases. The majority of people from dietary calcium, which in general is, we're not taking that much, the truth is. And even if we do, we don't absorb it very well. There's literally zero risk. From calcium supplements, especially in a form that is not bioavailable, so it's not in a food safe form, and in huge amounts that sometimes we know that they are prescribed up to 1,200 milligrams just from, for example, calcium carbonate, which is what usually is prescribed by doctors. It's a huge amount of calcium that even if you need calcium, you're not going to absorb it as efficiently and as effectively. And what is going to happen, maybe it can increase risk of cardiovascular disease, or it can end up on your joints and have a lot of pains and aches, or worsening arthritis symptoms.
Mm-hmm.
But again, this is not from dietary calcium. I would say practically zero risk unless there is some special rare condition that someone suffers from.
Yes, Exactly. So then can you, in your terms, describe what is the difference between synthetic calcium supplements and dietary calcium? Because I really like how you explained it before.
Yes, I think we had this discussion last Friday. What happens now is that we do get a lot of calcium that they still come from natural sources. Natural sources, for example, could be algae. Um, but they're not in a food state form, meaning that, I mean, we wouldn't eat algae normally. And I mean, some people do, but it's not as bioavailable as the kind of calcium that you find in normal food. Um, so in this case, the body cannot recognize it. I mean, the more the chemical structure or biochemical structure of something departs from what our body recognizes as food, the harder it is for our body to process it. And
Mm-hmm.
that's why we say supplements, in general, supplements, and especially supplements that are not in a food state form, yeah, okay, they might help in some cases, but actually, if you want to optimize your health, minimizing risks of other conditions, then it's best to go for food or for supplements that resemble food as much as possible, because this is very bioavailable and this is what your body is going to recognize immediately as food.
Mm-hmm.
And if not, the risk is that the body might react, and then depending on your genetics, the reaction could be quite extreme. I'm pretty sure, well, not pretty sure, I mean, I don't have evidence for that, but that's what it shows, that the more we try to eat things that are not really like normal food, the more our bodies react to them, see them as enemies, and maybe create some form of immune conditions or even autoimmunity. I'm pretty sure that this is probably another reason why we do get so many allergies and sensitivities, because what we have in our day-to-day life, what we are ingesting other food or
Mm-hmm.
supplements, is not very natural anymore.
Mm-hmm. So then can you list some top, maybe five dietary sources of calcium?
Well, except dairy, which is again is another big subject because some people are intolerant to dairy, and I'm intolerant to dairy. Um, but it is a good calcium, a very good calcium source, very rich calcium source. If there are intolerances, then the better your gut is, so the better state your gut is, then the better it will be. You will tolerate dairy. And if
Mhm.
it's a fermented dairy, if it's not processed dairy, then you'll probably be okay with it. So even if you're dairy intolerant, you will probably be fine
Mhm.
if you take care of your gut. So dairy is one. Then, of course, you have nuts and seeds. I know it's the oxalate issue, which we're going to address a little later. But you know, things like almonds, for example, they're very high in calcium, and for the majority of us, you know, majority for many of us, very very appropriate to have, and also people that are vegans or are dairy intolerant.
Mhm.
Then you have the dark greens that we all know, broccoli, spinach, etc. And again, they will say, "Oh, yeah, the oxalates," but the
We'll talk
oxalates in
about
them
it
can
in
be,
a second.
yeah, we'll talk about it. They can be deactivated with cooking, and that's what I recommend. Very nice sources for other nutrients as well, like folate,
Mhm.
which again, cooking also is going to activate. Then things like red kidney beans or beans in general and pulses can be quite high in calcium. Fish with small bones, very popular in Greece, where I spend most of my time here. I know some people don't have fish or don't like fish, but they also come with the omega-3 in them. And the very, yeah, I mean, the really very small fish that you can find in the Mediterranean, they're actually excellent because the very small bones that you can eat them very easily. You
Mhm.
know, it's not actually dangerous. You can even, kids can have them with a warning there, but in general, quite safe. I think I mentioned four. Then fifth one again would be any sort of animal products that we forget. And I know a lot of people are vegan or vegetarians, and too much of animal protein probably is not so good for our health in general, but it's all about balance.
Right.
And we shouldn't forget that things like bone broths, for example, that even if you don't like, meat on animal products very much, of course, if you're a vegetarian, you can't use that, but it's an amazing source of calcium as well, and
Mhm.
also collagen, gelatin, and protein itself. So I think these are the five sources, but of course, there is a lot more that you can find. The more varieties is your diet, and you don't restrict food and food categories, the better it is. But these,
Yes.
I would say, is the five richest I think, in my opinion.
Yeah, I love that. And I love that the first one that you said is dairy because we're going to talk
It's the
about
richest.
our calcium chews just for a little bit because Scene Nutrition's calcium chews, the ones right here, they are made from only real food ingredients and we source our calcium from milk. So instead of isolating synthetic calcium from rocks, from chalk, from limestone, from algae, whatever it may be, we take milk, and that is the source of the calcium plus the six other minerals in our calcium chew. So it's only made from real food ingredients. And I think that's the reason why, Maria, you resonated with this product. And so I want to
Absolutely.
hear your thoughts. What do
Absolutely.
you think about our product?
Yeah, I mean, I loved your idea and your product. One of the main reasons is because a lot of people, including myself, are intolerant to dairy.
Mhm.
And I'm not going to go into too much detail, but there is the primary dairy intolerance and the secondary dairy intolerance. The primary dairy intolerance means that genetically you cannot produce enough lactase. So it's lactose intolerance. It's not, overall dairy, it's more lactose. So in this case, you kind of stuck. So even if your gut is optimal, you still cannot tolerate too much dairy. And I like my dairy, I like my Greek yogurt, but I have to be careful with, well, the source, the quality, but also how much I eat, because it does affect my digestion. And in this case, when this happens, it can cause low-grade inflammation that chronically can interfere with your absorption of calcium.
Mhm.
So even if it has a lot of calcium, you don't absorb it as much, and you think you have because of this low-grade inflammation that is created for people that are intolerant to lactose primarily. So what I like with your product is that you kind of get rid of that. So you do get the calcium in its optimal bioavailable form that you can find in dairy, and you get all the, not nasty, but the things that can be problematic out of it
Mhm.
in a natural way without, any chemical processes or
Yeah.
anything. So for me, I was thought, oh, this is ideal, because when I was diagnosed, and that was 20 years ago now, and yeah, it was 20 years ago. So when I was diagnosed, I didn't know that much. Of course, I was still in nutrition. I wasn't
Mhm.
practicing as a nutritionist back then, but I knew quite a lot of things, but not so much about the condition. And I was prescribed 1,200 milligrams of calcium carbonate by
Mhm.
my doctor then,
Mhm.
while my vitamin D levels in my blood were also very low. And I ended up with a lot of calcifications in my body, to the point that they thought I might have bone cancer, because of the, little lumps that I had all over my body. So it was that bad. And I know that a lot of people have problems with calcifications or kidney stones, because they take a lot of calcium supplements that they cannot absorb. So very high dosages in a form that is not bioavailable. And sometimes even with, without having vitamin D levels that are optimal.
Mhm.
So in this case, for me, when I saw your supplement, I was like, over the moon. And that's how, we met and asked some more questions. And I thought, this is brilliant. We have to get this information out, because so many people are going to be benefit for this.
Yes, Thank you, thank you. I mean, I think we both have such a personal history with osteoporosis. That's the exact reason why I wanted to create this company because I didn't want to take and swallow these huge synthetic horse pills that my body wasn't using well. And 20% of the women who take synthetic calcium actually have stomach side effects like bloating, constipation, nausea. Some of you listening may
Constipation.
experience that. Yeah.
Yeah, constipation is another one, but that can go a little bit quiet because it's not as severe. But I mean, it can be severe if you have it chronically, and it can
Yeah.
have an effect on your absorption as well. And of course, it doesn't feel very
Yeah.
nice. But of course, you can have a lot more severe issues like problems with your heart and arteries and joints, etc. But even constipation or any form of digestive problem is not very nice, is it?
Not pleasant, especially if you're diagnosed with osteoporosis like us at 30 and we plan to live long, healthy lives. We don't want to live
True.
with that for 30, 40, 50 years.
Yeah,
And so,
yeah, and there is a lot to talk about, the diagnosis and everything, because in my case it was quite complicated. I mean, my diagnosis in the first place, they told me that I have the bones of an 80-year-old. And I was
yeah,
32.
yeah.
I was devastated. And as you know, I run this Facebook group. We've got over 13,000 people now there. And the majority of them are also terrified. And I really
Hmm.
feel for them because I also had that feeling. I had anxiety attacks because I was told that, even if I do exercise, well, exactly the opposite. We should do exercise, the right type of exercise. If I do exercise, I'm going to break my bones. So, I left my job. It was a really, really tough time for me. So I'm so glad that now, there's not so much fog and misinformation about the condition, and people like you and me and so many others are doing our best to inform and also learn and create things like your supplement, our programs to help
Hmm.
people.
Exactly. I know. I mean, we have like 7 more minutes and we have so many topics to cover. So I want to hit this
Sure.
next one, which is what is the deal with strontium? We hear this
Oh my
everywhere, right? Like,
God.
is it good? Is it bad? I want to
Yes.
hear your viewpoint.
Yes, it is a long discussion, like you said, but I would like to address that for sure.
Yes.
Strontium is a mineral, is another mineral. The There are different types. Many years ago, and maybe not so many years ago, there was strontium renalate medications and supplements, and that were given to people with osteoporosis and increased their bone density. And then they realized, as it happens sometimes, they first give it to people, and then they realize that it can create a lot of issues with your heart, et cetera, et cetera. So they stopped it then. And the last few years, we realized there is a rise of supplements,
Hmm.
strontium supplements, that are strontium citrate.
Hmm.
Strontium citrate is not considered, it's not a toxic form. And of course, you can find it in our bodies, and you can find it in foods and a lot of things that we have daily. Uh, but the problem is, you don't find it in the bones very much. I mean, the bones is like 98, 99% calcium, more or less, in terms of mineral. And then, a few other minerals like magnesium, zinc, boron, and etc. So there's not really much strontium there. So I'm not really sure how natural it is to get a strontium supplement that is going to end up in your bones, replace or displace even calcium in some
Yeah.
cases, just to make it denser, because it will be denser because strontium is heavier than calcium. So on a bone scan,
Hmm.
if it ends up on your bones, it's going to look denser. But so my first question is, do you want to have strontium in your bones? If it was supposed to be there in the first place, it would have been there, if
Hmm.
you know what I mean. But it's not there. So it's not very natural unless you want to become some sort of other kind and not the human kind. And then my second question with strontium is, okay, you may have dense or denser bones,
Hmm.
but is it actually stronger? A dense bone, it doesn't mean it's necessarily a stronger bone.
Yes.
which is another thing that, after 20 years studying the condition, I've learned. And I've learned the hard way because in the beginning I didn't know myself. And like I said, I was terrified. So that's my take on strontium. We have the bone, which has some minerals, the majority of it is calcium, well, on this matrix, which is like mainly from collagen. So
Mm-hmm.
you have this matrix, which is like scaffolding for the rest of the minerals. And the rest of the minerals is primarily calcium.
Mm-hmm.
And there's no strontium in there, or very little. So putting strontium in there, it just doesn't seem such a natural thing to me.
Right.
And then doesn't necessarily mean it's stronger
Mm-hmm.
anyway. So
Mm-hmm. I think that's amazing. Amazing explanation because you hit it right there that a T score, a Z score does not equal bone health. It's a number that's comparing you to what a normal bone is, right? So bone
yeah,
health is
and
so multifactorial.
absolutely. And thank you very much for saying that, because we cover all these things in so many details in my comprehensive course, about explaining the test, what test we should do, what the test means, etc. Like you said, yeah, it's just assumptions on many averages that, of course, it means something, but for the majority of people, it's very little information and it's very relevant. And it doesn't say much about your strength, your bone strength. It just gives you some information about the density. And as far as it concerns the spine, because of the way that the spine is, and especially if you have misalignment problems or scoliosis that I have, the results there could be very, very, very wrong,
Mm-hmm.
very incorrect, like it was in my case on the spine, and
Mm-hmm.
from clinical experience with others. So it is give you some information, but it's not all the information. There's a lot of other things, a lot of other tests that you need to be done, like probably we're testing bone markers, so you can see the bone loss rate, et cetera, et cetera, et cetera. So, but certainly, someone has osteopenia according to the T-score or osteoporosis, and they get panicked and they go, sometimes, not always, sometimes they can start using medications that are even appropriate for them and having side effects and having other conditions because of that. And this is what I'm objecting and I'm not happy with.
Mm-hmm. I think it's really important there to note that like each individual's treatment plan is going to be individualized. We started this conversation talking about precision medicine and precision nutrition. So
Mm-hmm.
that's the same thing with osteoporosis. What works for you may not work for others. Maybe some people are on medication and for the right reason, and some people try
Mm-hmm.
to seek out these natural alternatives that you highlight in your Facebook group. Um, and so I want to end with this final big question, which is about oxalates.
About
Oxalates are a
opposites,
pain in
yes.
my side because I get this question
Yeah,
all
I
the
know, me
time.
too. Oh my God. I had a long discussion in a group yesterday with another nutritional therapist and, with the client last week. Yes, I mean, oxalates. Oxalates called so-called anti-nutrients. There are a lot of like called anti-nutrients. So oxalates is one of them.
Mm-hmm.
Phytic acid is another one that you find in a lot of plants foods. Okay, so a lot of greens, a lot of nuts and seeds, etc. So naturally you find them there. You can deactivate them. There are certain tricks, for example, that you can do with cooking with nuts and seeds. You can do things like soaking and then rinsing, so you can deactivate some. For some people that have reduced absorption or increased oxalate, sometimes it could be because of genetics or other conditions, then it does make sense to reduce as much as they can, actively the oxalate intake from the food.
Mm-hmm.
But avoiding high oxalate foods that naturally are high in oxalates, like almonds, for example, because, okay, if I have them, they're going to, stop me from digesting, absorbing, and assimilating my calcium. This is not right. This is an extreme approach, which I don't agree with.
Mm-hmm.
So in very few cases, you may need actively to reduce, and ideally for a short period of time until you resolve the issues that are causing the
Yeah.
high oxalate. then yes. But to actively say, no, I'm not going to have any plant foods or any spinach or any almonds or any nuts because they're going to interfere with my calcium absorption, it either goes the other way. You're going to end up with very restrictive diet, which is going to do nothing, absolutely nothing for your bones. It's going to have the opposite effect.
Mm-hmm.
And just taking the opportunity from, the last question, about medications. Yes, I mean, you can have medications, of course, some people might need to, but at the end of the day, even with medications, nutrition is absolutely
Yeah.
necessary. So the kind of nutrition, the kind of lifestyle, the kind of the exercise you do is going to be supportive to whatever other your choice is. And in some cases, everyone is individual. It could be some form of medication.
Mm-hmm.
But even then, relying only on the medication, I mean, is not right. It's not going to be enough. And in
Yes.
some cases, it will, it will be even, in the test, they're not going to be much to see much improvement.
Mm-hmm.
So the most important thing is nutrition, lifestyle, and exercise.
Mm-hmm.
And then, of course, for some people, it's a matter of choice. It's a matter of their personal circumstances. They can be on medication as well, of course. But the nutrition, don't forget about that, because
Yeah.
even it's not going to take a pill and then everything is going to go away.
Right.
So
There is no
nutrition,
magic
lifestyle,
pill when
no,
it comes to osteoporosis or any other chronic disease. There is no magic pill. Um,
absolutely.
yeah. And so I think that's really important with the oxalates is that we're making in the general population, right? If you're worried about oxalates decreasing calcium absorption and then being really specific about when you consume oxalate-rich foods like almonds and when you consume calcium, that is too granular in my opinion. And so I think look at it more globally because even if you're at risk of developing kidney stones from oxalates, the number one recommendation from the National Kidney Foundation is to actually increase the dietary calcium that you consume because
Absolutely.
that calcium is going to bind to the oxalates in your intestine and prevent it from going into your kidneys to cause kidney stones. So whether you have risk of kidney stones or if you don't, you should still focus on obtaining enough dietary calcium. And that's the key takeaway. Like don't rack your head about, okay, I'm going to eat almonds at 9 a.m., milk at 10 a.m. I'm going to soak my spinach for it's too much, I think. Like it's too much.
It's too much, and it can end up, like I said, people with obsessive behavior around food, and this is not going to end well. It's as simple as that. You can't when you start getting obsessed about, oh, can I eat, my feta cheese with I don't know, lentils, because lentils are high in iron, and feta cheese is high on calcium, and iron is going to set off the calcium. Is like, this is too much, I
Yeah.
mean, or okay, I can't have almonds now because they're too high in oxalates, and it's just too much.
Right.
Or have it separately. Just too much. More important is, if you want to exclude stuff from your diet, just exclude the nasty stuff that is not food,
Mm-hmm.
ultra processed
Mm-hmm.
foods, junk food, that have all these glycation products. This is what you need to get rid of.
Mm-hmm. Um, yeah, I think that kind of leads into the last question that you wanted to bring up, which is what we talked about what you should be incorporating into your diet, which is dietary calcium in its natural food state. But what are things that we should avoid instead of, focusing on the nitty-gritty of oxalates, but what are some things, like you said, ultra processed foods, certain fish, because they have high toxicity levels of heavy metals. What else is there?
So, yes. I mean, yeah, with fish again, you just have to look at balance.
Yeah.
And, the smaller fish or fish that comes from deeper sea is usually safer to consume. And again, not in excess, not every day. I know that some people that are pescatarians and they try to get the omega-3s and the proteins from fish, sometimes they could overdo it. So in these cases, they need to be careful. But at the end of the day, it's all about balance. For
Mm-hmm.
me, I would say fish is probably, for the heavy metals there, it is a concern if you consume them, over-consume them. But for me, ultra-processed foods is probably the biggest culprit there, the biggest problem, because it's just everywhere, and you can find them hidden everywhere now. I mean, well, in supplements as well, but in foods like modified starch, super
Hmm.
ultra processed, and they add up. The kind of effect that they have is cumulative. So the more of these you eat, the worse it gets, and it's going to be interfering with your absorption
Hmm.
of minerals, especially because minerals are the ones that are most sensitive.
Hmm.
So ultra processed foods, I would say first, and then heavy metals from fish if you overdo it.
Hmm. Yeah, I think you're getting to the point is that things like junk food, ultra processed foods can alter your gut. And if your gut isn't working, then you're not going to be able to absorb everything else, the good that you're trying to do with taking supplements or increasing your calcium. You could do that all you want, but if your gut is not healed, then you're not going to absorb these things correctly. Um,
Yes, and it's very important with similar, as we said, with the calcium supplements, food state calcium supplements, the ultra processed foods, the body cannot recognize it as food. So it's
mhm,
going to be very hard to process. It's going to create problems, low grade inflammation, and eventually it's going to affect your gut wall and how you absorb nutrients. And of course, that's the first level of absorption. Then you have the second level of absorption at cellular level. And in this case, nutrigenomics and toxic levels play a big role. So it's a very complex thing, but we start with the basics. We start with the gut, and then of course, if you need to dive in deeper
yeah.
and refine and fine tune, you can do that. But
Mhm.
sometimes starting with the basic is enough.
Yeah, I agree 100%. It's like, let's get the foundation good to go. And then from there, you can build and you can work with specialists like you and me to really hone in on each individual person. Um, I think there's a question there. Is cocoa bad for absorbing calcium?
Yes, I love this. Well, in what sense would be that? I mean, cocoa or cacao, I love my cacao nibs, has quite a lot of antioxidants. It has, of course, some oxalates as well. Um, Again, I mean, I have a lot of cacao nibs. I actually have them with my Greek yogurt at the same time. If I had to take a calcium supplement, I would probably avoid having cacao nibs or dark chocolate as I used to have at the same time. But I wouldn't get too obsessed with mixing foods, my cacao with my Greek yogurt.
Yeah.
Um, because in nature, most things work in synergies. Yes, they find their own balances by themselves. Yes, there could be some nutrients that compete with each other, but they seem to balance out each other at the same time.
Yeah.
When with supplements is a little bit different. So if it's like a calcium supplement that you take at the same time that you eat or drink your cacao or eat your chocolate, maybe not such a good idea. But if you want to have your cacao nibs with your Greek yogurt, which I love to do, I don't think it's such a big issue.
Yeah, primarily because you're talking about it's food and food. Cacao nibs and Greek
Excellent.
yogurt is food. And the way that I view it is that if adding cacao nibs to your Greek yogurt is going to incentivize you to eat that Greek yogurt every day, then that's better than not eating it at all. So if you
Yeah,
put it together and it may decrease a little bit of calcium absorption very, very minimally, that's okay because at least you're getting them together. Um,
exactly. And like I said, yes, some nutrients, otherwise it would be impossible. I mean, all food have a lot of different nutrients in them.
right.
Some are competing with each other and some not.
Mhm.
So the nature itself, it's so wise that it can balance itself out as long as we have good absorption and minimal amount of toxins. So at cellular level, our cells are working as good as they can.
Mhm.
So they can also absorb at cellular level.
Yeah.
So I really believe in nature, and I'm not getting too obsessed with foods. And trust me, I used to be very obsessed around food when I started, my own journey.
Mhm.
I was like, I ate this at 9, then, I can't eat this until, 12. And I was really, really, really religiously, I would say, obsessive about food. And it didn't really make me very stronger.
Mhm.
I think when I started being more relaxed and just use common sense, which I try to do with my clients as well. That's when we see amazing results. And sometimes even with people that are older and you wouldn't expect to see so positive results, people in their 70s,
Mhm.
because we found out osteoporosis when we were young,
Mhm.
and it was still, it was a good time for us to build on something, because we found out when we were both very young. But sometimes people, when they're older and they find in the 60s, because they haven't done any scan before, which is the majority of people, it's harder to improve things naturally.
Mhm.
But even in these cases, when people are more relaxed, they know what they're doing. Either they have medication, some have medication, some not. Then is actually working okay, is working better for them.
Yeah, I mean, I think that's a perfect ending. We wanted to really drive home that osteoporosis is preventable. It's a disease that we have to focus on when we're young because our bone mass peaks around 30 years old. And so we need to be focusing on building our bone mass until that state because come later on in life, we're going to be naturally decreasing our bone density. And so if we build it up earlier on, then we have more reserves to draw from later. And
Mm,
coming from, personal experiences, even though both of our osteoporosis diagnosis was tragic and kind of traumatic, it allows us so many more years to move forward and change our lifestyle, focus on mobility, focus on strength training, maybe incorporate medications so that we can live longer and stronger lives for the last part of our lives. And so I think I just want to finish off by giving some information. Maria, you have a group, a Facebook group called
yes.
Osteoporosis and Osteopenia Natural Prevention and Support. It has over 13,000 members. So I encourage everyone to go and join that group. You provide guides and videos all the time. That's so helpful. And then if you're interested in trying Scene Nutrition's Real Food Calcium Chews, then just go to www.scenenutrition.com.
Yeah.
And we are only selling in the United States for right now. I think we're probably going to get that question.
Unfortunately, I'm just trying to get my hands on the products. Hopefully, when I'm in London. But yes, so I hope this is available later in Europe as well. But for the people in my group and my community, I'm going to offer a discount as well. So if you want some information about that, please stick with us. I'm just going to share this information later on, and probably we'll share some of this discussion as well, if it's recorded, I think, isn't it?
Yeah, we're going to do our best to repost it right on the Facebook group and maybe YouTube
Yes.
and just make sure that everyone got to hear these answers about strontium, bone health, dietary calcium versus synthetic calcium, oxalates, so you could go back to it. But yeah, we are working on expanding outside of the US and we will make sure to let everyone know when that is available.
Absolutely. I have a lot of I have a network of practitioners and nutritionists here in Europe and UK that are very interested, because there's not something similar in Europe,
Mhm.
as far as I know. And I've been doing this for over 15 years now. So we're really excited, and we'll be really looking forward to seeing the product here as well.
Yes.
Um, Another thing that I would like to mention, because there have been some questions and they were going really, really fast. So I was just trying to see, there was some questions about BHRT and about absorption. BHRT is body identical HRT, so hormone replacement therapy. It's a quite complex issue really to address here, I think. There is a lot of information about that in my group and later on with my courses. But in general, what I would like to say is that it can provide some help and some support with bone, especially if you start early.
Mhm.
If you add it on later in life, the bone health results was going to be probably minimal. And then, of course, you start having other risks increasing. So there are some benefits. Everyone is different. Again, it's an individual case. So with my clients, we always look at the genetics
Mhm.
before making any informed decisions. But the short answer is yes, in some cases it can be helpful, but the earlier you start, the better, if
Mhm.
you decide to start with it.
Yeah, yeah. Awesome. All right, well, thank you so much, Maria. This has been really awesome, and we should probably just do more of these because questions keep coming about calcium.
Yes. Yes, there's, I mean, and I'm really, really sorry. We'll try to address a lot of the questions that we've seen.
Yeah.
We have a date later in a couple of months or even less than that. When during the course you are invited.
Mhm.
So Jenny will be invited to have another Q&A session when we're running our course, which is 4 steps for osteoporosis. And we're focusing on nutrients.
Yeah.
So when we discuss calcium, Jenny is going to be there, and we're going to have a lovely Q&A discussion on Zoom. So I think maybe more people will be able to join this one. We'll see.
Yes, and people can find out about that through your Facebook group, right?
Yes, on Instagram in my profile,
Okay.
on top of my profile, yes, there is a link of how you can join my Facebook group, and of course you'll find me on Facebook group. It's the same name, so it's Maria Rigopoulou, and you'll see me nutrigenomics and bone health specialist. So I hope I see you there.
Yeah, awesome. Thank you so much, and thank you for joining, everyone. Take care.
Thank you. Bye bye.
Bye.